Now viewers, we all have seen that about food pipe, how it is, where is located, what are the problems related to it, how these easily can be detected by screening tests, and the importance of cancer and tumors in the esophagus, how can be diagnosed and can be treated. And today you all agree with me that technology has made a revolution in the treatment of esophagus. And particularly esophageal cancer is so common, the incidence going up. In spite, when 20, 30 years before, the treatment was not that effective and the complication very high, and people were afraid of cancer esophagus to undergo surgery. And now the technology has made it to operate in a different way and less traumatic, and through few holes, that entire cancer can be removed. And depending on the age group and various kinds of treatment like chemo, radiotherapy and immunotherapy and all, in addition to surgical, and you have seen so much different way, different parts of the talk you listen. Now the minimal invasive surgery, both laparoscopic, robotic, surely that it is patient friendly and very easily treatable. So now you all take it up. This is way that you have seen, but still it is the journey has to go longer way. And viewers, now you have been attended, whoever attended, now you can, whatever your doubts or your myths, you can ask. So this is a time that you can get clear. And this is the way you can take part and take this message all other friends and relatives, so that they will have the benefit of this and importance of revolution in treatment of esophagus. So one by one, whoever asks, I will be very happy to answer your doubts.
Sir, I have been having the acid reflux for nearly 5 years from now. So what will happen to me if such acid refluxes into my food pipe for a longer period?
And acid is all it is a corrosive effect. So naturally, when you have a heartburn or reflux, this kind of problem, and we have to undergo testing. And simple test, I already told, endoscopy is the best way to solve. But everyone will not have problem because of reflux. So some may have a problem with esophagitis, inflammation. Some people will have ulcer, what we call Barrett's, or some may be associated hiatus hernia, we don't know. So this is a very important issue. Should have testing, and depending on the testing, you have to undergo. So maybe problem or not, but once sure, then okay, we'll take it, there is no problem. But problem, attend to it by the time it is better to go.
So my uncle has already undergone an endoscopy. Doctor is suspecting a cancer. So what are the other tests should he undergo now?
So cancer does not mean it is the same type of cancer with everybody. So we have to know that cancer, what is the histology, biopsy of that we have to know. And second thing is more important, we have to know what is the stage of this cancer. So if it is endoscopy shown cancer, then they have to go next test, CT scan or MRI scan to see how far that cancer has involved this esophageal wall or spread to the lymph nodes adjoining or to the liver or lung or other stages. So next level is CT or MRI is to be done. And if a doubt is there, whole body would have spread, then we'll go PET scan. Otherwise, this test is okay enough to do it. Sometimes you want to know, otherwise endo ultrasound can be done to particularly take a biopsy from the lymph nodes adjoining the esophagus.
Once the cancer is confirmed and the stage is found, what are the treatment options available?
I think this is depending on the individual patient. What is the age, how fit is your lung and heart. Very important is fitness. And stage 1, 2, if it comes in the younger age group or fit patients, then we can suggest them to undergo surgery, which is we consider as a primary treatment. Suppose same, if it is advanced stage 3, T3 and T4, then this particular group, we have to go for chemotherapy, downstage the tumor, make it operable, then we should go for operation. Suppose if it is patient's individual condition is not good, a very old age and the cardiac lung function is poor, they can't withstand surgery, then for them we'll go for chemoradiation only as a primary treatment to treat the disease. And I don't know whether the particular individual has got obstruction or not. If it is obstruction, then we suggest them go endoscopic dilatation, put a stent, then subsequently give chemotherapy. So that one group straight away can get surgery, other group chemotherapy followed by surgery, and some of them to advance only chemoradiation. But in addition, to boost up their immune status, and immunotherapy is coming into play now, and that is also very important to take. I think future now we are medicine-wise and technology-wise, there are many ways to treat. So comprehensive treatment is the best way, and overall we have to discuss.
Sir, while I was coming through the exhibition, you have told esophagus is in the chest, but it extends from neck to the stomach. So while doing surgery, will you be opening all these areas? I am scared.
That is fair. This is a doubt everybody used to ask. Naturally, to approach the esophagus, which is in the chest, behind the heart and front of the vertebra. So to reach that area, generally we have to, in open surgery, we have to widely open to reach that area. Now it is not that. Now we do a keyhole and we make it a few small holes, and which we pass the gas, then automatically lung is collapsed, and we have a wider space to reach that esophagus. So now no retraction or handling of the lung, and don't touch the vessels and not touch the heart. So esophagus can be reached very well. That is that technique we developed, what we call prone approach, esophagectomy. And I've shown that video, you would appreciate it. And anytime you have doubt also, you can website, you can GEM hospital, you can look at, and the same thing you can doubt. Very easily can be approached. And also do abdomen side, make a tube, also go into the mediastinum, we can dissect it. I think esophagus, minimally invasive, wider magnification is more, that clarity of tissue so nicely approached with less trauma, that esophagus tumor can be removed very well without bleeding.
Oh, this reassures me, sir. But I'm also afraid, through small hole, can a cancer be completely removed?
Yeah, this is where doubt always, when a new technology comes, people always doubt it. And but at the same time, when other way take it, mobile or TV or anything, look at, the people accept it, no, that's way. It because it is lack of awareness and confusion. But compared to open, here only we can identify the tissues far better, and clarity is much more better. And now the new technology kind of instrument is so thin, slim, and magnification. We can exactly look at the tissues to remove, and now en bloc. That means tumor, esophagus, also adjoining tissues completely removed. That's why today with the technology, recently all the published articles says lowest recurrence at the bed. So that's why it is completely removable. Not only that, we can even, but naturally we can't see that tissues can be detected by new technology like ICG and so on. I think completely, there is no doubt regarding that way.
So you have told foot pipe is a tube connecting throat to the stomach. Now if you remove this tube, will we be using some other tube from outside to connect the throat to the stomach?
Yeah, this it is natural only, and what we do, it is not that to put like a prosthesis between, no. And here stomach is such a wide tube, pouch like, and God has given stomach much bigger than what we need. So what we do, we partly cut the stomach so that instead of pouch, it becomes a tube like narrow, and that tube will become longer. We take to the neck anastomosis, either to neck or in the chest itself we can make it. It is the stomach only we doing it. But some places, sometimes we have to advance cancer. In addition to esophagus, we also remove the stomach also. That particular cases, we go for taking either small intestine, jejunum, or the colon, and we'll take it, replace between the intestine and the neck. That is also feasible and been doing regularly, and this is possible, and it is natural.
Sir, if we do so many changes in my gut, will I be able to eat normally after surgery?
Yeah, this is always, once natural is being changed, like a bypass, making a road different way, initially there will be changes. We'll advise them to take a soft diet and frequent meals, and for getting adjusted, maybe at 2 weeks, some people 1 or 2 weeks extra. By the time full, and they be able to take normal kind of food and without any change in their diet pattern, and they can eat well, and digestion will be normal. So that's why it is able to eat, and initial adjustment and doctor's advice they have to follow, and it can be. That is, all kind of food can eat.
My father is a farmer. Can he do a routine work after his treatment?
This is minimal invasive surgery as revolutionized that way. I think I will take it up, say, and apart from short stay in the hospital, as soon as they get back to normal, there is no cut, there is no incision, there is no disability for them. So whatever kind of work they were doing before, same work they can do it. Maybe initially 2 weeks or 10 days, 15 days rest is essential to pick up their own. Otherwise, no restriction. They can do any kind of work without any difficulties.
Since my father had cancer, can I also develop cancer of food pipe?
Yeah, there are some cancers familial. It can come. That is very few. But esophageal cancer is generally caused by food, lifestyle changes, habits, and also environmental chemicals, all like these kind of things. So those days when the people used to chew tobacco and other things, and when they used to get squamous cell carcinoma, that is very common in Asia, including India and our own place. But now lifestyle changes, people started taking more kind of a fast foods and more, they are put on weight. Most of them become obese and like this. So now adenocarcinoma is also going up. So these are esophageal carcinoma generally caused by an individual factor and environmental, not familial. So that way nothing to worry that parents, one of them has got the same cancer will affect you, and don't worry about it.
Once treated, will my father get cancer esophagus again?
It is, if it is detected early stage, you treat with a surgical removal, and the chances of recurrence very rare. It all depends on the stage after surgery. We will be knowing RO, that means completely removed. That case recurrence rare. But same time we do a stage 2 and 3 and we operate, the nodes are positive, for which preventive way we used to give chemotherapy. But still, whatever we go prevented, the chances of getting back is there. Not everybody, some of them may develop it, depends on their body status. If a good individual immune status is good and physically better, and the recurrence very rare. Immune is down. Today you have seen the COVID time, the immune is so bad. That's why last 10, 15 years we are seeing various kinds of infection disease also going up. Similarly also cancer. So if immune status is poor and old age, some reason, then they may develop a recurrence. So have to periodically check up with the doctors according to our doctor's advice, have to follow. That's why possibility is there, and we have to regular checkup. Screening is very important, surveillance, and lifetime, no problem that part.